I'm appreciative that I'm alive to be able to speak about this topic. I also thank God that I'm a beneficiary of some of the people who have gone and left the stage for us to continue to thrive. SCAF is Sickle Cell Hope Alive Foundation, and it has a reason for the meaning. There is a meaning for the name, which I may not have time to explain. It's a scarf on your head to cover whatever it's on there, so that the world will see you in a better perspective. That's what the scarf is all about. And we started in 2012. Our vision is actually to reduce the burden of sickle cell disease throughout Nigeria. Because Nigeria holds the first position. Nigeria is the hub and the epicenter of sickle cell disease globally. So we want to bring this burden down. And the burden is so high for many reasons. We have the largest population. Our genetics, which is what I spent my whole life studying, is the worst type of genes that we have inherited surrounding the sickle cell gene, so that it's not helping it at all. That's why we are, part of why we are where we are. Number 3, we are in the malaria belt. If you look at the map of the world and see where malaria is, that is where we are, and that is where this disease is the most prevalent. So we have these reasons why we have a huge burden. And this huge burden is telling on every family, every extended family. If you don't have in your family, you have in your extended family. And that is why it is important for each and every one of us to focus, find a niche, try to do something that is meaningful in reducing that burden. And that's what Sickle Cell Hope Alive Foundation is saddled with. And from our mission, we've tried to fill some gaps that are in existence in Nigeria. Why this burden continues to be high, why people continue to suffer. Many of them are really poor. They've been impoverished because this is a lifelong disease. As long as you're alive, you battle with it. You spend all your earnings on it. So we want to reduce that burden in whatever way we can. That is our mission. That is our goal. And we keep every day striving to meet that goal. And I am Professor Adeyinka Falusi from Ekiti State. And I've been planted in Ibadan since 1966, going to the University of Ibadan. I'm from Efon Alaye, the city set upon a hill that cannot be hidden. Yes. Vibrant, long-living people. So I was stationed in Ibadan since 1966. When I got married, I finished my first degree in 69. My husband finished in 68 in agriculture. He's a professor of agriculture, agricultural economics, one of the best. I'm a professor of hematology, and we've lived together, 5 successful children. We are happy with what God has done for us, and we want to do something for other people. To talk about sickle cell disease, because I've spent the last 50 years doing work on sickle cell disease. Both in America, everywhere I go is sickle cell disease. So I have a lot to talk about. And I'm going to talk about the fact that I'm grateful that people are now joining me to do this work. It's enormous. You can't cover sickle cell problems, but you can do something. You can make a dent. You can make an inroad and do something that will be meaningful. So SCAF is sitting down there as the host of this event, bringing in about 500 patients. In fact, all of them are now willing to talk. In the past, they will say, I don't want people to see my face. I don't want them to hear that I am doing something. I don't want them to know I'm sickle cell. And I used to tell them, I'm working with ghost workers. When I take all my money, I put the label on my head, I'm talking about sickle cell disease, you are running away. It's not going to work. Because people say, where is your million? Where did you spend it? So I have to be able to point to the people taking my money. So they are coming live in large numbers. They are even wanting to their stories. I don't know where to write it. So at the end of this, I even want us to write a book that will have the stories, a lot of stories. Put them in there, along with who is helping us, and publish it, and let others read it. Encouraging words that we can say, these are these people saying it themselves. So there is a lot to do. I'm going to talk about it. We have a keynote address by the Vice Chancellor of Chrisland University. She's one of my proteges. She's learned in my lab. She's a pharmacist, and she's now the Vice Chancellor, and she's the Treasurer of SCAF. She's going to give the keynote address. I'm behind there. I used to be director at Institute for Advanced Medical Research and Training, and I know all I did there was on sickle cell disease. Research upon research, publication upon publications. I don't want to bore you with that. Hundreds of publications. So there are things we can do. You see, God gives us a life to live. It may be short, it may be long. But how do you spend those days God has given you? And that's what I tell them all the time. Stop saying somebody is going to die at 18. Somebody is going to die when he's 21. Stop saying that. Only God knows. Yaliko lived for 95 years. So Chief Ogundoyin died at 51, but he was hardworking. He didn't sit down in his house and crumble there and say, oh, what is my life like this? No. He was out, vibrant, working, telling people, this is what you need to do to help yourself. Do your work well, do this. So he was out there. He put himself there and did a good job of his life. The 51 years were well spent, invested in his children, invested in his family, had a good job he was doing, made money, gave the money to good causes. These are things that we encourage people to learn from. Don't sit down there and have mental problems. Sit down there and say, if God gives me another day, I am going to do this. I'm going to achieve this to the best of my knowledge. So we teach them, we counsel them, because many of them are driven away from their homes. They say, and we encourage them. They come to us. We encourage them. We do birthdays for them. In fact, now we're going to be raising funds through that area. They will say, you are our family. Come, SCAF, come and help us do this. So SCAF is now getting accolades from people who understand that we are there for them. We are just there for the patients. I don't need cars in my life. I don't need shoes. I don't need anything. The Lord has done it. And the little I have, I want to give and give and give till I'm not holding anything, and I'm going to report to who sent me. So he's done the same. He's gone before us. He's giving what he has. And we know he can still give more through his children, which is what I intend to do. Because I'm doing legacy now by making younger people take over my stuff. The president of this association is my first daughter, who is a professor of medicine in America. The one who came last week, he's a doctor in Gilead. He's a vice president of Gilead. So God has done my own things for me. God has done his own things for him. The children can now help us to bring up a good framework and a strategy that will make this collaboration live and reflect what we stand for, what he stood for, to the test of times. What I stand to gain as a person is that you want to do as a foundation. You want to do something in your life. You start it and it doesn't collapse on you. People want to know more. People are anxious to get more from you. Every day they are calling and saying, can we come and join you? Can we get better health through your system? My child is being discharged in the hospital. I don't know. I can't get a penny to pay. They call me so many times. I don't know what to do because I have very limited pension. My pension is almost running out after how many years have I been doing this now? Every money that comes in my purse, I spend on this thing. And I believe that with the Ogundoyin family, we can have a strategy whereby we say, year one, this is what we hope to accomplish. Even if he's publishing these books, they call me in Abuja, they call me in Calabar, they call me in Port Harcourt. I go to the bus station, I make these books, I give to them. Even if they start with that, print it themselves, let's put supported by Ogundoyin family, and I distribute to the sickle cell centers. There's so many of them. At the back of this book, if you open it, you see all the sickle centers that I imagine. They are there, many of them, but they don't have the resources. There are many, and we can even give them books to teach people. It's primary 6 English. We did this in collaboration between College of Medicine, myself, one pediatrician, and another pediatrician from the US. And we put a beautiful thing here, chapter by chapter. What are the challenges? How do they handle the thing? When do they take immunization for their children? What do they do? We can even start the newborn screening. We've done an interview. We've published a paper on it that we went to the mothers. Are you ready for newborn screening? What that means is that if we can get the HPLC and the reagent to do it. We go to the hospitals. As soon as this child is born, the first day the child is born, we can take the sample, we can diagnose, and say, this sickle cell child, start taking to this doctor. Instead of waiting for this child to become swollen hand, yellow eyes, and all that, which comes after many months. But we will tell them, direct them to where they should go. And that can help the mothers to feel better because they now know where to go. It is not a question of dabbling around. By the age of 2 months, the doctors will give them penicillin and other things that will make the infection on these children be reduced. Those are things we can start with. And then we can go on and say, okay, we have a center where the adult ones can be engaged, fully engaged, so that if you are not employed, you can do something, learn something, go and do it at your backyard and make money, take care of yourself, and stop getting neurotic in the head. There are a lot of things they can do. We just have to sit together and pipeline. I knew very little of him, but it was impactful. I was a junior colleague at the College of Medicine, University of Ibadan. At the time, he was vibrant, hardworking. We knew about his name, and he never hid the fact that he was a sickle cell. He was a person living with sickle cell disease. He came with poise, he came with dignity, and he did his best to help those who are in academia to pursue their goals of doing something about sickle cell disease in terms of research, in terms of spreading the work to other places outside Ibadan. So I became a beneficiary because I was then a young colleague that was working on my master's degree at the hematology department, and he gave us a grant then in the department to go to Calabar and paid for the conference that we did on sickle cell disease. That was my taste of him, that this guy was good. He was interested in improving the lot of those people who have the same disease by we doing research along this line. So that's the little I knew about him. But over the years, when he died, we went to his house and we said, we hope the family will continue to bring more input into the legacy he was trying to leave behind, because he died at a young age of 51 years. And we knew that if he lived longer, he would have done much more. So we were urging the family that we hope that they would continue to contribute. And that's what's bringing about this collaboration, this partnership between Sickle Cell for Life Foundation and the Ogundoyin family that's coming up in a few days' time. And we hope that when we have finished this event, we will go further to firm up some areas which they can chip in and leave an indelible mark in the name of late Chief Ogundoyin. There are millions of people waiting for help, and our own goal is to help them. And I know this collaboration is going to bring out more help, more support for patients, people living with sickle cell disease. And that's the ultimate. One, we started the NHIS support. We hope that the Ogundoyin family will be able to help us to fund more people who can access better health through that insurance. The national body has now accepted for us to support, and they will register them. The Oyo State couldn't cope. They said they come every day, they cannot register them, but the national body has decided to register, and we started that just this March. Now, there's something called empowerment. If somebody is down and trodden, and you don't give him a job to do, he has this illness to battle every single day he wakes up. Definitely, his brain is going to keep going to that place every day. But if you occupy him with something good, we're thinking the Ogundoyin family can help us to do some empowerment programs. We send these people to the University of Ibadan to learn how to empower them in the place. We go to the Agric Extension Unit. They teach them how to make beads, how to make soap, how to make shoes, how to make so many things, which they can do at their backyard. If nobody employs them, they can do something with their lives so that they can be meaningfully and gainfully employed. And if we support that goal, definitely millions of them, or many of them, thousands, will always remember this family. Another legacy we think they can leave, that it can help us to to get to is the fact that we need, look at where staff is working. We need a place, we need a building that we can name as Ogundoyin Sickle Cell Center. And when we have that center, I can tell you, if I already have a plan, we will have an empowerment section. There are people ready to teach them, to make shoes, to make this and that. We will have a section for them. We will have a section for medical doctors coming in at regular intervals to come and take care of them. We will have a section where people in the community can come in and have awareness programs. Maybe a hall where we can say, every Wednesday, come in, we will counsel. We have a place where we have a monthly lecture and we will counsel people and we will encourage them and carry out their awareness. So this will be a good center if they can get to that. We are collaborating with NYC already. That's another program. In fact, we are catching them young in schools now. Every week, the corpers are in the schools, allocated there by the NYC to teach them about sickle cell disease. And I'm so happy about that program. If you see them in the classrooms, you will think that we are teaching English and maths. We are only teaching sickle cell disease. So they will know the challenges, they will know how to prevent it, they will know what they should do in future as young people to do these things right so that this burden will be reduced. So we have a lot going on. And we know the Ogundoyin family, by talking to us, can have a niche, can fill a good gap, can fill a meaningful gap for us. And the patients, the people living with sickle cell disease will be forever grateful. And that will be a good legacy for him. And the children can do that. That is our life. I was the head of IMRAT for many years, did ethics of University of Ibadan, put ethics into this one, because if you don't do ethics, you are not doing it well. You've got to do it properly. Anything you are doing, do it properly, credibly. So I gave that standard to University of Ibadan before I retired in 2010. And when I retired, I said, well, I'm free now to do what I want. So in 2012, I founded the Sickle Cell, with my husband, founded the Sickle Cell Hope Alive Foundation. And it has been thriving slowly to this stage. So that is who I am.
If you had not told us you retired in the year 2010, the fact that you look well preserved.
We thank God. I'm 69 years. I'm 79 years old now.
79 years old.
79.
You look like something.
It's the grace of God in my life.
We really thank God for your life.
Thank you.
If not for the fact that we do not have that luxury of time, in fact, we would have loved to hear more.
You can come again. You can come again.
So we want to appreciate you more, and we are praying that the vision you look forward towards achieving, as far as this collaboration is concerned, will definitely be achieved.
Thank you.
So